the probability for you to walk into a health center and find no doctor, no paramedic, taps without water, and no electricity. If this is in rural India, the probability is quite high. This is what data tells us, and we will tell you all about it in this week's Data Details, a video series by Business Line. Before we delve into the data, you must know what PHCs, SCs and CHCs are. A sub-center or an SC is the first contact point between the people and the healthcare system, while a primary health center or a PHC acts as a referral unit for 6 sub-centers and is to be manned by a medical officer supported by paramedical staff. A community health center or a CHC is a referral center for 4 PHCs and must be manned by at least 4 medical specialists. And now the numbers. In 2005, 17.49% of PHCs and sub-centers in the country functioned without doctors. But the proportion of such centers were as high as 21.83% in 2021. While less than half of the community health centers had no specialist doctors in 2005, the vacancy was 67.96% in 2021. When it comes to female health workers or auxiliary nursing midwives, the number of primary health centers and sub-centers divide of them has jumped from 4.75% in 2005 to 27.16% in 2021 when the pandemic was ongoing. It is also shocking to note that all the community health centers in Sikkim and 95% in Madhya Pradesh are devoid of a specialist. 43.2% of the primary health centers in Chhattisgarh and 37.7% in West Bengal also do not have a doctor. And in Bihar, 72.12% of sub-centers have no female health workers who are supposed to manage them. If you think this is bad, wait for it. We have more grim tales to tell you. Many health facilities are functioning without water or electricity supply. In Bihar, 31% of the primary health centers have neither water nor electricity supply. 20% of these in Uttarakhand and 16% in Kerala have no regular water supply. What could be the reasons behind it? Do they have repercussions, and what do we do to make things better? Experts like Dr. Gagandeep Kang from Christian Medical College, Vellore think that a lot has to do with the lack of incentives that the doctors receive. Others have blamed it on plain neglect and think that we need instant reforms and make health topmost priority in the country. To know that if things have gotten better, we have to look at the stats a couple of years later. But we have more to tell you on the current stats. To know that, check out the link in description. Before you leave, do like, share, subscribe and wait for us until we get back with another episode of Data Details next week.